How's it going, everyone? Trying to get used to the new routine, so I'm still slow as usual. That probably won't change. You can't teach an old dog new tricks. But anyway, today's video is going to be about the thyroid. I cannot exceed 15 minutes. Um, I'm going to discuss to you about hypo and hyperthyroidism. I'm also going to read to you out of my anatomy book again like I did with the diabetes video, so that way you get a better glimpse of the whole thyroid stimulating hormone. Now, I do want to talk to you about the bar blend project. It is so cool. Elise is the instructor. If you love yoga and Pilates, you will love this program. I'm starting week 3 next week. And I'm going to tell you, those little exercises do burn, but they will help you tone. If you're looking for beginner's exercises, this is the way to go. And if you have your Shakeology, you'll be in good shape as well. And stick to the cookbook, the nutrition guide, and stay healthy, and you will finish it with success. This is an 8-week program, so I'm looking forward to the next week and such. But anyway, what I was about to say is Elise is probably one of the best instructors. She has a very inspiring story. I encourage you to go try out her program. And when you watch the beginning, you'll feel even more touched about her. So please support her. Please support Beachbody in Demand. Become the new you. And I'm hoping I can get you guys through it. And I'm hoping that I'll be able to actually get the hang of this, because I've had a lot of hard blocks in the road lately. But anyway, I'm a bad camera lady. I'm about to set this phone down. Oh, just a minute. But anyway, I'm going to try to not run my mouth too much. But one thing that you need to know is when we talk about the thyroid, it has a lot to do with our metabolic function, and it has a lot to do with our weight problems too. As a matter of fact, my father had Graves' disease, and that was one reason why he got so heavy. It wasn't just the fact that he had diabetes and heart problems. That contributed to it. But when we go over this, we are going to go over a couple of the signs about Graves' disease because it's in the section. But anyway, thyroid stimulating hormone, or TSH, or thyrotropin, is a tropic hormone that stimulates normal development and secretory activity of the thyroid gland. Its release follows the hypothalamic pituitary target endocrine organ feedback loop. And see, that's one of the beginners parts that we did in anatomy class in college. As a matter of fact, we actually got to do a couple of exercises based on that. We even got to practice with a couple of cow examples, like cow thyroid, and we got to play with that. But anyway, that's for another time. Anyway, now we're going to go over the location structure. The butterfly-shaped thyroid gland is located in the anterior neck on the trachea, just inferior to the larynx. A median tissue mass called the isthmus connects its 2 lateral lobes. The thyroid gland is the largest pure endocrine gland in the body. Its blood supply from the superior and inferior thyroid arteries makes thyroid surgery a painstaking and bloody endeavor. Internally, the gland is composed of hollow, spherical follicles. The walls of each follicle are formed largely by cuboidal or squamous epithelial cells, called follicular cells, which produce glycoprotein. The central activity, or lumen, the follicle stores colloid, an amber-colored sticky material consisting of the thyroglobulin molecules with attached iodine atoms. Thyroid hormone is derived from this iodinated thyroglobulin. And see, one thing that's really interesting about the thyroid is it has a lot to do with our iodine in our body as well. But one thing that we have to be careful of is a lot of the foods that we have today, or even some of the salad dressings that have so much iodine in it, can mess with our thyroid too. It's also an imbalance or a balance of iodine as well. Now we're going to go over the thyroid hormone, or TH. Often referred to as the body's major metabolic hormone, thyroid hormone, TH, is actually two iodine-containing amine hormones, thyroxine, I slaughter the English language all the time, otherwise known as T4, or triiodothyronine, that's a long one, I'm sorry, or T3. T4 is the major hormone secreted by the thyroid follicles. Most T3 is formed at the target tissues by conversion of T4 to T3. Both T4 and T3 are constructed from two linked tyrosine amino acids, but T4 has 4 bound iodine atoms in T3. Now see, in our anatomy class in college, we actually got to do exercises with T3 and T4 with iodine composites, and if you get in a chemistry class, it's even more fun. But anyway, we made a bad joke about this because we couldn't pronounce the hormones names right. We would just say T3, T4. We just said that was a shortcut because we couldn't say the word. But anyway, if you're from the South, then you really slaughter the English language. But now we're going to go over both the hyper and hypothyroidism and activity now. Both overactivity and underactivity of the thyroid gland can abuse severe metabolic disturbances. Hypothyroid disorders may result in some thyroid gland defects or secondary from inadequate TH or TRH release. They also occur when the thyroid gland is removed surgically and when dietary iodine is inadequate. In adults, the full-blown hypothyroid syndrome is called myxedema. It is mucus swelling. Symptoms include a low metabolic rate, feeling chilled, constipation, thick, dry skin, puffy eyes, edema, lethargy, and even mental sluggishness. A goiter, which is an enlarged protruding thyroid gland, occurs if myxedema results from a lack of iodine. The follicular cells produce colloid, but cannot iodinate it and make it functional hormones. The pituitary gland secretes increasing amounts of TSH in a futile attempt to stimulate the thyroid to produce TH, but the only result is that the follicles accumulate more and more unusable colloid. Depending on the cause, iodine supplements or hormone replacement therapy can reverse myxedema. Before iodized salt became available, the Midwestern United States was called the goiter belt. Goiters were common because this area had iodine-poor soil and no access to iodine-rich seafood. In places where goiters are especially common, these goiters are called endemic goiters. Like many other hormones, important effects of TH depend on a person's age and development. Severe hypothyroidism in infants is called cretinism, when it is due to iodine deficiency, and congenital hypothyroidism, when it is due to a congenital abnormality of the thyroid gland. The child is intellectually disabled and has a short, disproportionately sized body. That's a long word, I'm sorry. Anything long, I have to say it slowly, or it just turns into garble. And a thick tongue and neck. Cretinism may reflect a genetic deficiency of the fetal thyroid gland or maternal factors such as lack of dietary iodine. Thyroid hormone replacement therapy can prevent cretinism if diagnosed early enough. But developmental abnormalities and intellectual disability are not reversible once they appear. The most common hyperthyroid pathology is Graves' disease. In this autoimmune condition, a person makes abnormal antibodies directed against thyroid follicular cells. Rather than marking these cells for destruction as antibodies normally do, these antibodies paradoxically mimic TSH and continuously stimulates TH release. Now, typical symptoms of Graves' disease include elevated metabolic rate, sweating, rapid irregular heartbeat, nervousness, and weight loss despite adequate food. Eyeballs may protrude if the tissue behind becomes fibrous. Treatments include surgically removing the thyroid gland or ingesting radioactive iodine, which destroys most active thyroid cells. Now see, we got the cat. Hey, Twilight. Guys, in case you ever find out from my video, I've got 3 cats, and this is the old fella. This is Twilight. All right, you go play now. But anyway, my father had Graves' disease, and that was one of the things I was about to tell you about. One of the main common signs is the bulging eyes. He had a lot of broken blood vessels behind his eyes, and that was a lot of the fibrous tissue being broken down. He had very poor vision. That comes as part of it, eventually, gradually over the years. But what I was about to tell you is iodine salt is one of the main things to stay away from right now, unless you have an imbalance or a deficiency. A lot of the salt that we have in our restaurants now, and as much as I love them, any French fry that you get with the iodine salt is something to stay away from, because now they're saying it can aggravate our thyroid. A potential of hypothyroidism. Anything with mercury or iodine, especially tilapia fish or anchovies, that can aggravate your thyroid as well. And if you look at salad dressings, especially Caesar salad dressing, if you look for anchovies, you have a potential of having that in your salad dressing. So if you see iodine or any of those ingredients in your salad dressing, please be careful and check them out. And what most people are saying now is, if you have thyroid problems, is to make your own vinaigrette dressings at home, something natural based, more vinegar, balsamic vinegar, or even white vinegar. White wine vinegar is very healthy for us, so red wine vinegars. But that's one of the more common treatments, is removing the thyroid gland. And after that, your diet will change, because a lot of people do experience a lot of weight gain afterwards, and it's just one of those things where it'll just change your life. But anyway, in the next video, the next nutritional video, I should say, we're going to talk about scoliosis. And the reason why is because I'm actually a patient. I have mild scoliosis. I've had it since I was 11. I actually had chiropractic done as a child. But believe it or not, when I was a teenager, I treated it by myself with yoga. And next week, we're going to go over some yoga techniques for beginners with scoliosis as well. But anyway, the Bar Blend Project is very good for it, because it has lots of yogas and Pilates. You do a lot of stretching. A lot of the prep workouts I love. And, it's not going to be the point where it just throws your back out or anything. That's one of the best things about it. But anyway, tank top and yoga pants means we're about to do the arm workout shortly, and I shall see you soon.